This report is not a witch hunt, and this report is intended to highlight where the issues are and to highlight what can be done.
It's good to see that the medical fraternity are reacting to the concerns of the public.
This is the first time that a report like this has been disseminated.
The Zambia Medical Association has received or had received a number of complaints with regards to maternal and newborn care, mainly emanating from the University Teaching Hospital, our major hospital in Lusaka. And so the association undertook the survey to try and find or define the root cause of the problem, find where the issues are, and make recommendations to that effect.
We tried very hard to train nurses as they came in at all levels. My appeal when you did your survey was, did you see how the capacities who were trained were left to do their job?
Zambia is among the countries in the world with the highest death rates among the newborns and women of the reproductive age group. Every 4 hours, a Zambian woman dies during pregnancy-related conditions.
Neonatal sepsis, yes, has been one of the major factors that have contributed to our neonatal mortality, particularly in UTH. And one of the things that have led to that is the congestion that we've talked about and the shortage in the staffing. So infection prevention practices have been very difficult to achieve because of that. But we are working around the clock to improve on our own practices of infection prevention. And I think with what preventative measures we are putting in place at the moment, we hope to see a reduction in the infections, particularly sepsis from UTH and the old.
Thank you for the report. I think this is a very good start. We need to get all the other departments to do the same so that we can be able to highlight not only the problems, but the solution to the problem that we are actually facing in the health system.
I think as government, we are very happy with what the Medical Association of Zambia has done by doing a survey on, and also reacting to the concerns of the public on the services being provided to the people.
We won't stop congratulating you because we feel this is the way to go with solving problems. Identify the problems and then see what you can do about them.
I'm very glad that I think finally ZMA has set us moving in terms of thinking about coming up with a new modern maternity ward in UTH.
We're delighted to be a part of improvement in the healthcare in Zambia and very interested in the Zambia Medical Association's report. I will say that this is, in my opinion, a universal issue in healthcare, is how do we get quality care to the people as they come to our clinics and our hospitals.
Well, I would like to give credit to ZMA to start with for commissioning the work on this report. This was an initiative of the Zambia Medical Association entirely, and this report was a response to the concerns from the members of the public about several issues that has been observed in the province of Lusaka to start with, and I think in the entire country about the maternal and child health care.
It's good to see that some of the problems that we can relate to as medical students, because we are also on the labor ward and we also work in the clinics. So it's good to see that something is being done about it. And as we enter the profession, we're better able and better equipped from the findings of this survey to at least try and do something and try and create solutions for the problem.
It is with a great sense of pride and humility that on behalf of the President of the Zambia Medical Association, Dr. Aaron Michajati, I would like to express our deep gratitude to a number of partners.
We'll see more of these kinds of activities where we would want now to go into issues that have to do with our standards of practice, protocols, and issues like that.